Hi Facebook, welcome back. It's been a little while since we've seen you. We hope you all survived Hurricane Matthew and hope everybody in Florida and along the East Coast is safe and sound after Hurricane Matthew. We are excited to have all of you back today. We have Paula and one of her amazing patients actually working on her under eyes and seeing how we can get her to look a little more refreshed and rejuvenated, and ask Paula all the questions we have about really our under eyes and what we can do to fix it, because I know it's an issue a lot of women have. So let's see what she has to say and find out. Here we go. Hi Paula, hi Crystal, how are you?
Hey, good.
How are you? Thanks for joining us, Facebook audience.
Happy Thursday. So we are talking about eyes today. So Paula, why don't you tell us a little bit about what we're going to be doing with Crystal?
Okay, so Crystal's here. She's young, beautiful. What she complained to me about was these under eye circles. She has this little line, which from the side sometimes you can see it a little better. This is called the tear trough. What happens is we start aging, structural changes occur in our skull, and our orbital socket that holds the eyeball starts elongating, which shows this ridge and indent, giving people a tired appearance. So the easiest trick to treat the tired appearance indent is to do a little filler right into this crease, and it immediately gives it a rejuvenated look. I always like my worst case scenario, so I warn my patients that in this area, because this is the thinnest skin on the body, you can puff up and get swollen. So it could be about 3 days where you look puffy. Sometimes you see fluctuations within this. I've noticed if you have a lot of sodium intake on a day. So I always prefer to undercorrect the area so that if someone has too much sodium, you don't see this puffiness, okay? So I say whenever we touch the eye area, you want to plan just in case, don't have an event for at least 3 days, a week if you want to be safe. What I'm going to do with her today is we're going to inject Bellatero, which is a hyaluronic acid. There's many different types out there. This is just what we're going to use today. And we're going to use a cannula, which is a technique that it's not a sharp needle. It actually has a blunt tip. So I just pinch her once, and then we'll lay the thread underneath her skin, okay?
So the cannula lets you lay it just like a thread to almost have like a line of exactly where you want that filler, as opposed to just dropping droplets in there?
Right, because there's a lot of blood vessels, and some people prefer this method. I just think it's convenient, and for her, she's a good candidate. So we'll just put the cannula underneath and just lay the thread underneath, which won't break other little blood vessels in the area. When we also talk about the eyes, she would also be a good candidate. If you look up close, you see that she has this like purplish discoloration, and what happens is that because the skin is so thin there, you get to see blood vessels and things like that. We do laser treatments with the pulse dye laser that will help get rid of that pigmentation under there, but multiple sessions are required.
So that's those dark circles that tend to haunt most of us women, including me.
Exactly.
I have them genetically from in my family, from my great-grandmother all the way down. And these are women who have been obsessed with skincare. And if you can fix my dark circles, I'll love you forever. This is the product that we're using today.
I usually use mostly Restylane. I don't have a problem. I like the Bellatero. Juvederm just came out with a off-label thin hyaluronic acid small particle, which will be a good Volbella to use probably as well. But like I said, she's young. We got some of this product, so that's why we're going to use this.
Those of you who haven't heard of Volbella, it's because it's a brand new filler that's come from Allergan, which is the same people who have Botox and Juvederm and Voluma. So Volbella is a new filler from them, and we're actually one of the first practices in Miami and South Florida to ever even have the product and be able to use it. So
we're going to show you real quick this cannula, okay? If you think of a real needle, you don't have to look if you don't like needles, okay? This isn't the size we inject with, but it's one that we can use. I'll use to pierce the skin. A real needle has a beveled tip, which is a slant, and the product comes out the top. A cannula looks like a sewing needle where the opening is on the side and the tip is not sharp. So that's the only difference. So you'll see. So you just keep your head like that.
some of you might remember the cannula from when Dr. Polo used it. Dr. Polo really likes to use the cannula as well. He actually uses it for different areas. He used it on lips. Paula likes to use it more so for the tear troughs.
So this is the one pinch that they feel. And see,
That's it.
she has that one little spot where she's bleeding from just the needle stick, okay?
Was that pinch okay for you, Crystal, or was that really painful? It was just
good.
a quick...
It's really quick.
And she had a little topical anesthetic, so it really doesn't make it a big deal. So
We do
when I
everything we
inject,
can to
I want
keep you
like
guys
that.
as comfortable as possible during any of these treatments.
Okay, so now
Let's kind of come
this
to
is
this
just
side
getting
so
it
we
under
can
the
see.
skin. Sorry, hold on.
Gotta find the right angle without getting into Paula's way.
Sorry, this can be the only uncomfortable part. Is when we're getting the needle, this cannula under the skin. Tell me if it's uncomfortable.
Crystal, how excited are you to
Okay.
awake and be beautiful tomorrow?
So we're under the skin. Okay.
Well, I guess even more beautiful. You've always been beautiful.
So if you guys are looking, when her eyes are closed, you can't really appreciate the indent. So open up your eyes. Okay. If that doesn't freak you out, just stay just like that for me. So I don't know if you can see where my needle is going, my cannula, but I'm going back and forth just because I like doing a little bit at a time to make sure that how things look.
Paula, I have a question for you. As you're putting in the filler, is there ever a fear? I mean, I don't know if it's a difference with the cannula or just injecting it, but is there ever a fear that she might end up with like almost like a little ball of filler more in one place, that it's a little more dense than in another, or is it usually pretty?
I mean, it can definitely happen. It's just about the technique used to push the product out. So again, you can always go back and add more. You can also dissolve these products, injecting an enzyme.
Good to know.
It only dissolves the actual hyaluronic acid, which is what we inject, and it doesn't dissolve other parts of the skin
Okay.
or tissue.
So if something were to happen, there is a way to
Of
almost
course,
reverse
absolutely.
and fix any of those
How's it
issues.
feeling for you?
It's good.
So even with her, if we look at her now, it looks better, but we still see a little bit of an indent right in the middle.
But that's, I mean, talk about immediate gratification, because you can notice right away
Immediately.
that if she's getting, she just looks rejuvenated, and she looks like she had a great night's sleep.
Exactly.
It's basically what's happening.
Okay, so I kind of like that look. Like I said, I prefer my patients to have a little bit of an indent versus too much, because if we start seeing those fluctuations, then the puffiness, if it isn't, the worst thing is overdone lips. Second worst thing is overdone under eyes. So we want to keep things natural. I might end up going back a little bit, but I'm gonna see how this.
We definitely don't like the overdone look, viewers. If you've noticed over all of our Facebook lives with all of our providers, we are all about natural and not overdone. It's really the best way. Any cosmetic treatments should be virtually invisible to others.
All right, here's the pinchy part, Crystal.
So here we can kind of see on this side that it's, I mean, that's immediate gratification. You can almost see before and after from the right side to the left side.
And here she'll start getting a little puffy too. Again, we might add more, but it's better to do it little at a time. Okay, so head like this. I always like to keep my patients with full gravity is at best, because then you can really correct where that indent is versus if they're leaning back too much.
Now, Paula, how long should she expect these results to last?
Depending on the products, it should be anywhere, I think Bellatero is about 6 months, 6 to 9 months.
Okay.
This eye area generally lasts quite a nice amount of time. My go-to is usually Restylane, which will last you a year.
Okay.
So generally this should last about a year in this area.
Is there any particular reason you choose to choose different products, or it's just kind of based on the patient and what you're trying to correct on that particular person?
It's always based on the patient and, you know, how translucent her skin is. Some people that have darker skin, you might not notice certain products. There's certain products that, due to the way they're constructed, if they're too superficial, give off a bluish effect. So people that have lighter skin, you wouldn't want to choose one versus the other. This product specifically, you can put very superficially and it doesn't have that bluish discoloration, which, since she's so fair, is kind of why we went this route. So this one actually corrected very well and very easily.
That looks amazing.
I
So
went to
we
another
have
job.
one of our viewers who says, that must hurt, no way. Well, Mercedes, just to let you know, since we numb you up with numbing cream, you may have a slight discomfort from that first little pinch. But if you notice,
Yeah.
Crystal hasn't even flinched, and
It's
she's been
actually-
getting
yeah.
filled up. We're almost done with her.
The cannula method actually hurts less because it freaks people out. I will say that, just knowing that there's something by them. But because the only part that hurts is when you're cutting the skin with that first initial needle stick, the other is just, this is pushing aside any muscles, nerves, tissues under the skin. So it doesn't hurt. It's just the fact that you feel something moving in there that can freak people out. But it's no pain or cutting, okay? When you get it into the little opening, it can be a little uncomfortable, but that's it. Okay, look up for me again.
I mean, either this doesn't hurt at all, or Crystal has quite a poker face. Because she hasn't flinched. I mean, her eyes are not even tearing, which is surprising only because of that sensitive area. I'm sure many of you viewers have had teary eyes just from plucking your eyebrows, just because of that sensitive area. This is, wow, the left side looks incredible. Viewers, I don't know if you can see that, but that indentation, that line that she had is pretty much gone, and she even has a little bit of puffiness there just from the filler.
And from the, doing the needle sticks. So I'm quite happy with something like this, okay? You'll still, and the same thing when people have surgery for their blepharoplasties or you do things. Whenever you have pigmentation, and this is how you can see, the pigmentation can create the tear trough defect as well, and that when you push the skin down, you see that it moves. So that's not something that a filler will correct.
Right.
This is why you sometimes need that two-prong approach where we're going to fill in the defect, and then in a week or 2 weeks we can start treating her with the V-beam to get rid of the pigmentation. That's the pulse dye laser I was talking about.
Oh, that V-beam. I can't wait for you to do it to me, Paula.
Yes, that'll be another airing.
We
You'll have to
will
follow us on it.
definitely have videos of that so that you can all see all the amazing things that the V-beam laser can do, because it does not only work for those dark circles. It has a lot of benefits to it.
So she's already starting to swell and get a little puffy. So you're really going to have to follow up with us in a week, and that way you can see her full results. Because now, again, that tissue's so thin, we manipulated something under there a couple times. So now she's starting to get that swelling and puffiness, okay? So it obscures the results. But you see how you can already look
Oh,
a
yeah.
little fresher?
So Paula, Mercedes was asking about
You can always
this
add more.
being to remove bags also, but we're not really removing the bags. We're just...
If you're removing the bags, that's more of a blepharoplasty, where they would go in and they cut the little fat pad that lives behind that skin that can pop out. When
Right.
this
So you have to have
hormone
actual
socket
surgery
erupts.
to remove the bags.
Right. But what we can do is try to hide it. We can also use devices to maybe compress the fat behind it and then fill the other areas so that it's less noticeable, and that's the non-surgical approach. When you do a surgical approach, then yes, it will last longer. But people will usually have to do something on the eyes maybe once a year in order, non-invasive, non-surgical, to have a fresh appearance, okay? So what she's going to do is she's going to put on a little bit of ice just for a couple seconds on either side, maybe 10 minutes total, and then she'll go on her day as normal. There's no restrictions. She'll have that ice pack so she can keep using it if she starts to feel puffy. I always recommend that tonight you're going to sleep with extra pillows so you're more elevated, because you want that fluid to drain, okay?
Okay.
It's very likely when she wakes up in the morning, she's going to be the puffiest she's been all day or ever, since she's never done anything yet before. And that's normal. If you're not too fair-skinned, an at-home remedy, as long as you don't have any allergies and things, is getting some black tea bags, making sure that they're not hot water, but cool water, and applying them over the eyes when they're cold for about 10 minutes, because the caffeine can help constrict the vessels and help get the fluids to drain a little bit, and using your ice again for the first 24 hours, all right? That's it. She can put makeup on. I'd rather her not put it on today, since that little opening is there. We don't want
Right.
anything getting into the skin. But other than that, really, personally, I think she could probably go out and no one knows she did anything. No bruising, and the swelling, she just looks like
I mean, here, right after, viewers, if you take a look, she just looks rejuvenated and refreshed. I mean, you can't even tell that anything was done, which is amazing. And we will definitely follow up with Crystal again next week to see how she looks a week after her treatment, when any puffiness or anything has gone completely down and away.
Yes. And at that point, with any injectables, my point of view is my patients are my canvas. They're my work of art, and you've never seen an artist do something and walk away and never look at it again. So I always say, little things at a time. We want to look at her again when the swelling's gone down and determine if she needs a little drop more or if it's perfect the way it is. And that's our motto here is little by little, so our patients look fresh and natural and like themselves. Okay, so that's very important. But thank you for joining us.
Thank you so much for joining us, guys. We had a blast with Crystal and Paula today, and we will definitely check back with you soon. Stay tuned to see what's coming up next. Thanks, everyone. Bye.